So now we're ready for the patient, and we'll have the patient come in and sit down. Now, you've actually truly never had this done before, have you?
No, I have not.
Okay, so this is your first visit. Let me ask you a couple of questions now. On a scale of 1 to 10, you told me that you had some pain issues with your neuropathy. On a scale of 1 to 10, with 10 being the pain is so intolerable, it's totally intolerable, or 0 being nothing, where would you suppose your pain level is right now? Let me ask you first, though, what kind of pain? How do you experience it? How does it affect your life, your lifestyle? What happens to you?
Waking up in the middle of the night, burning feeling, shooting pains.
Okay. And you've tried other things?
Yes.
Okay. Obviously they're not working, so that's why you're here.
Right.
Okay. All right, on a scale of 1 to 10, as I started before, what would you say your discomfort level or pain level is right now?
About an 8.
Oh, that's pretty high. All right. What we're going to do is I'm going to have you put your feet in the water, but first I'd like you to reach down and touch the water and make sure that the temperature is comfortable for you. Touch both sides. Our technician is real good. We just want to make sure. Is that okay for you? Comfortable with that?
Yes.
Okay. Go ahead and put your feet in the foot bath. That probably feels pretty good just like that, doesn't it? We're going to do even better. What I'm going to do now is take the ReBuilder. This is the ReBuilder. It's powered by a 9-volt battery. See that? Some patients get so relaxed when they do this at home, sometimes in the office, because I'm going to have you control the dials, is that sometimes it falls off their lap into the water. If that happens, see those 4 screws, we take them off, hit it with an air dryer, keep right on going. This can't hurt you, it's only a 9-volt battery. So I wanted you to know that. So you hold that in your hands. And now what I'm going to do is I'm going to drop this one on each side, and you won't feel anything. What's going to happen is that the signal from the ReBuilder is going to go into the water, and it's going to go from this foot to this foot. And since it's electrically isolated, the waters are separate, the only way you can do that is to go up your calf, your knee, your hip, across the junctions in your lower back, down this knee, calf, to that foot. It's going to go back and forth like that, waking up your nerves. It's going to feel a little tingly. It's going to feel good, almost like a massage. You're going to enjoy that. So if you sit back just a little bit, okay, now take a deep breath and just relax. You're going to enjoy this. And we're going to watch in a minute what it does to your feet. So I'm going to turn it on first, and you're not going to feel anything. I just want to get it going. You notice that we're on the 7.83 dial. There's 3 of these modalities, but we're going to go on to 7.83. Every time that light blinks, it's going to send a small signal. Now you have 2 kinds of nerves in your periphery. You have sensory nerves, and those are the things that cause you to feel, and you have motor nerves, and those are the nerves that conduct the signal to get your legs to move. If you were to stub your toe, first you feel it, and then instantly your body takes over and sends a muscle signal to move that foot. Now, not everybody is successful with the ReBuilder. Some people are not. We don't know exactly what the status is of your sensory nerves and your motor nerves. So we're going to turn it up for a little bit until we see if we can feel something. If you can feel something, then that means your sensory nerves are intact. They're not dead like some other physicians may have told you. They just need to be awakened. Some people turn it all the way up, they can't feel a thing. That means probably not going to work. So we're going to cross our fingers here and hope that we can get that to work for you. If we can feel it, we're going to experiment and go a little bit higher and see if we can get these calf muscles here to kind of jiggle. And if we can get that to jiggle, then that means that the motor nerves are also intact. And if the motor nerves are intact, then we know that this is going to work for you. It's not a matter of if, but when. Does that make sense to you?
Yes.
Okay. So what I'd like you to do now is gently turn that up. Just turn it up real slow. Okay, turn right there. Stop there for a second. Do you feel that? No. Well, okay, let's see if we can go up a little higher. What number do you have it on now?
Almost at 2.
Okay. Feel it yet?
No.
Okay. Well, I don't want to get you too discouraged or encouraged. Go ahead and turn it up. Let's see if we can get you to feel it. Just keep going. You'll feel comfortable. Just feel like a little buzzing or tingling if you can feel it.
Okay, a little bit.
You can feel it. Really. You're sure you can feel it. That's great. That means that your sensory nerves are intact. We're halfway there. So now what I'd like you to do is relax again, lean back, Everybody gets kind of excited here because they're hoping maybe we can control their pain. Now what I'd like you to do is to continue to turn that up. I'm going to roll your sleeves up just a little bit here so we can see your calf muscle. I'd like you to turn it up some more until it almost feels like, gee, that's a little bit much. But go ahead and turn it up. We want to see if your calf muscles will start to jiggle. Just keep going. Keep going. Sometimes the first thing we'll notice is a little disruption in the water, almost a little bit of splashing. Keep going.
Okay, I'm really feeling it now.
Okay, you should feel pretty intense now, right? Okay, that means that your nerves are not only working, but they're giving you accurate feedback. Because the higher you go, you should feel it. Now keep going some more. Just play with it. It's not going to hurt you because we're going to bring it down from this upper level. But we want to see if we can get your feet moving and your calf muscles moving. Okay, keep going. Sometimes I can feel it before you can.
More.
Yeah, just keep going. All right, I'm beginning to feel just a little bit.
Mm-hmm.
Can you feel it?
Yes.
Okay. Now just rest. What happens is that one muscle works on another and then trains the next one. Now can you see the water kind of jiggling a little bit in here? That's the muscles. And if you can look here, can you see your muscle? It's actually moving. Can you see that?
Yep.
We're actually getting some motion from your muscle. So that means that your motor nerves are working. So you have functional sensory nerves and you have functional motor nerves. Now this is exciting. This means that it's going to work for you. You are responding to the system already. Now another thing I want to point out to you is if you can get a little shot of this. You see that your blood vessel here? As I push on it, it's extended, distended. We're building up. When a calf muscle contracts, the way the blood flows is that your arteries, your heart beats, it pushes blood towards your extremities. If you were to cut an artery, it spurts every time your heart beats. But then it has to go through miles of capillaries in order to get into the veins, and the way the blood gets back to the heart from the veins is by muscle contraction. So we are causing these muscles to contract, and we're building up pressure in your veins. Can you see that? See that vein all popped out there?
Mm-hmm.
So if ever in the hospital they said, hey, I need to get veins and blood out of your arm, and you can't do it, you can say, well, give me the ReBuilder and we'll take it out of my foot. So now just sit back and relax. If that's a little too intense for you, bring it down a little bit.
That's fine.
Okay. You'll notice that you'll accommodate after a while. And if you feel like you can turn it up, it should be only up to the point where you could really fall asleep if it was on. It should not be uncomfortable. How's it feel now that you're getting a little bit used to it? So you're going to turn it up some more. See, now you can play with it. The water's actually moving pretty good now, and your calf muscle is moving. You can see the calf muscle alongside the wire alongside your muscles, causing the wire to move. See that? So how does the treatment feel to you? Is it comfortable? Is it painful? It's comfortable?
No, comfortable.
Okay. Good. Now while you're sitting here, what I'd like you to do is just focus on your breathing. Just breathe in and out. When we get nervous, sometimes we breathe shallowly. Sometimes that can actually contribute to the neuropathy. When we get anxious, we breathe shallowly. We don't have enough oxygen in our bloodstream. The nerves use a lot of oxygen, and they rely on that. If they don't get enough oxygen, they can temporarily go to sleep. So we want, while you're at least doing the treatment, to breathe deeply and relaxed. I'd like you to even think about a time maybe in your past when you experienced something, a place or a situation where you felt very safe and very comfortable. Some people even like to close their eyes. It's up to you. But if you could get yourself just to relax. For the next few minutes, there's no other place you need to be, nothing else you really need to do. The more your muscles relax, the better this works. Okay? So now, we're going to let you stay here. The machine will shut itself off in